Hello, I'm Dr. Alan Nissenson, Professor of Medicine, Director of the Dialysis Program, and Associate Dean at the David Geffen School of Medicine at UCLA. I'm also the Editor-in-Chief of Medscape Nephrology. I'm pleased to introduce a new video blog related to home hemodialysis. This underutilized modality of therapy is recently undergoing a resurgence, primarily due to new information on potential benefits, particularly more frequent application of dialysis at home, and the availability of newer hemodialysis machines that are much more user-friendly. To present some information on home hemodialysis, we've asked Dr. Alan Hull, who will be joining me shortly.
I'm Alan Hull, and thank you, Alan, for that introduction. Since I started in home dialysis way back in 1968, and then lived through the growth of in-center dialysis, and finally ended my academic career as a transplant nephrologist, I can summarize this blog by announcing there is a new life available for dialysis patients utilizing home hemodialysis. This is possible because of the availability of new, simple, portable equipment that does not require home reconstruction. These changes are led by the NxStage System 1, where I am the Senior Medical Director. Nephrologists and nurses have long maintained in surveys that up to a third of patients in ESRD could actually dialyze in their homes. If this is correct, the question is why are only about 1% of the patients on ESRD dialyzing in their homes when there are so many benefits? Let's look at some of those benefits. Time is very important to the patient. From a weekly look at their weekly schedule, the dialysis itself, 12 hours in center, 15 plus at home. The setup equipment favors the center, but you often must wait. At home, it's 15 to 20 minutes per treatment. Travel is a real problem, as all patients know, and I've estimated it takes about 4.5 hours per week, dialyzing 3 times. At home, it's 0 because the patient is in control. But probably what's more important to the patient is the recovery time after dialysis. Bob Lindsay, in a controlled study, demonstrated that in the center group, the recovery time was about 7 to 8 hours post-dialysis. And this was shortened because patients went to bed. Similar, Lindsay compared the home patients' daily dialysis was about 35 minutes to recover, and for nocturnal it was only 12 minutes. That is a total of about 18 hours gained per week when the patient feels normal. In addition, quality of life improves, depression gets better. In hospitalization, it decreases by 40 to 50% in 2 studies from the West Coast by Kaiser and Wellbound. Our own studies using standard mortality ratio decreased the mortality by 50% in the 2,500 patients from NxStage compared to United States Renal Data System patients matched for age and gender. Finally, at the recent transplant meeting in Toronto, Chan's group reported 10-year survival results on 155 nocturnal patients compared to 351 transplants from deceased donors, and their survival was equal. This was somewhat surprising, but that's what the data showed. How do we explain these benefits we see at home but not in center? Dialyzing 6 times per week during the day or longer at night comes closer to how our own kidneys work 24/7. 3 times per week is merely marginal. In addition, a multitude of small studies have demonstrated decreased medicine requirements and essentially allow an unrestricted diet. Looking at our home hemodialysis patients shows that the patient is in control and loving it. They don't argue for less dialysis like in center, but many actually seek more because they feel even better with the increase. Dialysis patients can finally attain what pioneers like Scribner and others always dreamt about: normality on dialysis. Thank you very much for your time. If you have comments or questions, you can put those into the blog to Dr. Nissenson or myself. Thank you very much.